Hey everyone, this is Dr. David Song from Rehab here. On today, we'll be talking about hip bursitis, a painful condition that could be affecting your hip. We'll be going over exercises for the acute, subacute, and late stages of healing, so take a look. If you've been dealing with hip issues and it's still there no matter how much you stretch it, how much you foam roll it or massage it with a massage ball or massage gun, it could be because you need to start strengthening those muscles instead. This is because strengthening exercises or stability exercises will actually cause positive adaptation of the muscles that are affecting your hip, and that's what you got to do next. In the hip, there are sacs of fluid called the bursa, and the purpose of these sacs of fluid is to provide a frictionless surface for the muscles and tendons of your body. But sometimes when there's a lot of stress going through that hip because of repetitive overload or repetitive overuse, these sacs of fluid can become inflamed and be the cause of pain in the hip. This is because when they're inflamed, they do get a little bit larger and they become pain sensitive. So when those tendons then need to move over across these sacs of fluid, it can become very painful. Some things that can bother you if you have hip bursitis is simply walking, leaning on one leg when you're standing, or sleeping on your side with that affected hip on the bottom side of your body. The first set of exercises that we'll be doing is for the acute stage of healing. The acute stage of healing refers to days 1 to 4 following the initial onset of your injury. What we want to be focusing on is giving you the ability to control this hip without any external resistance. So we'll just be using your body weight and gravity as a resistance for that hip. The muscles that we'll be targeting today are collectively known as the glutes. Specifically, we'll be targeting the gluteus medius muscle and the gluteus maximus muscle, as these muscles have some of the largest influence on the function of your hip. The first exercise that we'll be doing is called the wall banger. This is a really great exercise for targeting those outer hip muscles. All you need is a wall. So you're going to start with your foot closest to the wall, about 1 foot distance apart. So I like to just bring my toes right up to the wall. And then from there, I'm just going to rotate my foot so that I'm standing parallel to the wall. Your other leg, you're just going to bring it about hip distance apart, whatever is comfortable. It doesn't really matter too much. From here, all you're going to do is shift the hips sideways until you tap the wall. Okay, so you're going to have a light bend in the knees here. You're going to shift over, tap the wall with your hip, and then stand back up. So notice that I'm not actually leaning onto the wall. I'm actually controlling my hip movement. And from here, I'm not even leaning into the wall either. I like to kind of visualize that this wall is made out of like rice paper. If I put too much weight into it, it'll actually tear. So from here, it's actually better to just almost hover rather than actually touch that wall. When you're at that bottom position, it's really important that you make sure your hips are actually squared forwards and not rotated too much. If you rotate too much, you're going to take the movement away from the gluteus medius, which is okay if you want to target the gluteus maximus a little bit more, but for the hip bursitis that we're talking about, it's better to target these gluteus medius muscles. And shift over. And when you're at that bottom position, you actually want to hold that position for about 5 Mississippis or 5 seconds. So you hold it there and then you can stand back up. Now this exercise is deceptively hard, so give it a few tries. When you're doing this exercise, it looks easy, but it is difficult. The next exercise that we'll be doing in the acute stage of healing is the heel elevated bridge. Okay, so you need something like a chair or a plyo box. I'm using a plyo box today, but you can use any old chair or stool. And you're just gonna place your heels on it and then lie down so that there's a 90-degree bend in the knees. From here, plant those heels into that surface so you make sure you don't want to slip. Hands can be on the ground if you need the extra support, but if you can do it without it, I prefer it without it. And from here, you're going to just simply lift the pelvis off the ground until your torso is in alignment with those thighs. And then you're going to come right back down. You'll feel this in the muscles of your hamstrings and your gluteus maximus. If you want to feel it more in the gluteus maximus, just make sure you give those butt cheeks a nice good squeeze at the top, and then you're going to come back down. You're going to do anywhere between 10 to 12 repetitions. I like to do a good 2-second count at the top before returning back to your rested position. You could do 2 to 3 sets of this as well. And you're going to just do this exercise once every other day, just like the wall banger. All right, we'll be moving on to our third exercise. The third exercise that we're going to do is a wall slide side kick. So all you need is any wall. Now I'm using a mat against the wall. If you don't have one, that's okay. Just put on a pair of socks and just slide up against the wall. So first you're going to do is really align your body so that your back is right up against that wall. What this will do is put you in a proper alignment. From there, your heel is going to go into the wall as well. And I'm actually pressing backwards into the wall right now. And I'm pushing through my heel. From there, you're just going to maintain that backwards push and slide your heel up as far as possible. You want to make sure that your pelvis doesn't roll off the wall either. So everything's pretty snug up against there. You're going to feel the muscles of your hip activate. You're going to go up until about 45-degree angle or so. Hold that position for up to 5 seconds, and then you're going to come back down. The other thing you need to think about is that you're not hiking from the pelvis, okay? So you want to keep that pelvis level and low as you're raising that leg, because otherwise you're using your back. Now, there's nothing wrong with using your back. It's just we want to isolate this movement to your hip so that could be the most effective hip exercise rather than a back exercise. You're going to do anywhere between 6 to 8 repetitions. If you can do more, do more. And we're going to do about 3 sets in total. You'll do these exercises every other day, just like the wall bangers and the heel elevated bridge. All right, so next we'll be moving on to the subacute exercises. The subacute stage of healing occurs between days 4 to 14 following the initial onset of your symptoms. The purpose of doing exercises during the stage of recovery is to start introducing some amount of resistance or load to the muscles of your hip. So this means we're going to either use weights, we're going to use exercise bands, whatever it takes to start giving your muscles a little bit more of a challenge. From here on out, the exercises that we're going to be doing will have a difficulty of 6 out of 10 difficulty, which means that the exercises aren't so easy that you can do 20 repetitions or more, but they're not so difficult that you can only do less than 10. The exercises have to be at the 6 out of 10 difficulty level if you want to achieve some sort of change or positive adaptation in the muscles of your hip, because we need that change, we need that strengthening, we need that stability to occur in the hip so that you don't aggravate your bursa so often. The difference between the hip thruster and the bridge that we did earlier is that we're going to get into a deeper range of motion from a starting point, and you're going to be able to actually add some weight to those hip muscles. So first things first is you're going to start in a seated position with your upper back braced up against that bench of yours. You can take weights such as dumbbells or a barbell if you have access to it. You're going to place it along the front of your hips, just where the bones are. And you're going to hold it in place with your hands. From there, keep your feet planted about shoulder distance apart, and you're going to keep your core braced. From there, you can have the toes off the ground if you want as well. Drive through those heels, raise the pelvis up, and you're going to go until your torso is about the same height as your thighs. You can hold for 2 seconds if you want, and then come back down all the way until your bum touches the floor, and that completes a single repetition. You're going to do about 8 to 12 repetitions, right? Making sure that you're feeling those glute muscles fire up. Now, if this exercise is too easy, just use a heavier weight. You can increase the weight 5 pounds at a time until you find a weight that is difficult for you to do for 10 repetitions. Now, unlike your gym workouts, you don't need to fail at 10 repetitions. I like to have about 2 to 3 reps in reserve in the tank when I'm doing these exercises. So if you could do 10 repetitions, but you still have 2 more in the tank to do after, that's like a good weight to use. All right, the next exercise that we'll be doing is a standing banded side kick. So you're going to need something like a loop band. If you don't have a loop band, you can use a regular band and just tie it to a loop. But what we're going to do is place this around our ankles, okay? And the working leg is the moving leg. So if you have right hip issues, you're going to be moving the right leg. You can use something like a wall, squat rack, or anything to keep you stabilized and hold it for balance. And all you're going to do is do a side kick, much similar to the one that we did on the floor against the wall. Now, it's really important that while you're doing this, that you're not just teeter-tottering your body, which is why I want your body to be stabilized using something like a wall. You also want to make sure your pelvis is as level as possible, so you're not just side crunching the hip up every time you're doing these exercises. So from here, you're just gonna hold it out, aim to hit about 45-degree angle or so. Going to hold that for up to 5 seconds. You're gonna feel those glute muscles fire up, and then you're going to just come back at 1 to 2 second tempo, and you're going to do anywhere between 8 to 12 repetitions. Now, as you get stronger, you can use a heavier and heavier band. And if you max out the thickest band that you have, you can then start just layering multiple bands in order to give you the appropriate amount of resistance. Just like the last exercise, in every exercise in this stage of the program, you want to be able to get that 10 rep count and have it pretty difficult, aiming for a 6 out of 10 difficulty. Remember folks, you want it to be challenging, not easy, but you don't want to fail at the exercise either. So it's kind of that middle ground that we want to aim for. Okay, so that's the banded side kick. We'll be going on to our third exercise next. All right, so the third and last exercise that I'll be showing you in the subacute stage of healing is the banded squat, but with a small modification. So you're just going to take another exercise band, and you could choose a slightly heavier or thicker band than the one we use for the side kick. You're just going to loop it around both of your knees. So you can loop it around either above, below, or right on the knees. It really just depends what's most comfortable for you. I like to go right on the knees. From here, you're going to take a nice wide base stance, at least shoulder distance apart. Your feet can be facing forwards or slightly out 15 degrees, whatever's more comfortable for your anatomy and body type. And then from there, you're just going to squat down. So you can let your knees pass your toes, okay? Keep the core nice and braced. And while you're doing that, we're gonna hold this bottom position and really focus on pushing those knees out so that they're aligned with the middle of your foot. So you want that kneecap to be just right between your second and third toes. And after about 5 seconds or so, you're going to come back up, take a breather, and then you're going to do another repetition by going right back down into that deep squat and go as low as you can go without it aggravating your hip too much. So if you find that when you're first starting out your subacute stage exercises early on, you might not be able to go all the way down pain-free, but you can start partway through and just come back up from there. And as you progress through these exercises, you should find that you're getting stronger, you could go deeper, it'll feel better, okay? We're going to aim for about 10 to 12 repetitions with this, and you'll be doing, once again, 2 to 3 sets. It really depends how much you can tolerate. So the late stage of healing is really about using exercises that are going to restore some functional capacity back to your body. The first exercise we'll be starting with is the step down. For this exercise, you're going to need something like a plyo box, or if you have no access to that, you can use any good old stair step. You're going to be starting about 12 to 14 inches from the ground, okay? So if you're at home, that's about the second step on your staircase. And you're going to start from the standing position, the top position. From here, you're going to get one leg off of the stair step, and you're going to just slowly lower the body until your heel taps the floor. From there, you're going to come back up, okay? So from a side profile, what you're doing is, unlike a step up where you're stepping backwards, you'll be stepping down beside you, okay? And what this will do is that it'll change the way that your body is loaded. You'll feel it a lot more in both your glute and your quad. Down and then back up. When you're doing that bottom position, you can do a short rest there, but what you don't want to be doing is resting on this leg. You'll be still having most of your body weight on the elevated leg. You could do about 8 to 12 repetitions and 2 to 3 sets. And once again, these exercises are done every other day. All right, let's move on to our next exercise. All right, so the next exercise that we'll be doing that's really good for loading up the glutes and incorporate glute strength into lower body function is the Bulgarian split squat. You could do this with or without weights. It really just depends how strong you are. To get started, what we're going to do is, for the affected side, you're just gonna step out with your leg to find out where your good footing is gonna be. From there, you're gonna stand up and just place your other foot on the seat or bench that you're going to be using to elevate your foot. From there, you're just going to come down, load up that front leg with most of your body weight. The back leg is just there for balance. So technically, if I was at the bottom of this Bulgarian split squat, I should be able to kind of just like gently raise my other leg because it's not carrying that much body weight. So coming back up, loading up that glute, and then coming back up. If you feel an excessive stretch in your opposite hip, the one that's elevated, it usually means you're too far away from your foot. So that means you might be a little bit too extended, okay? So what ends up happening is you're just going to feel a really deep hip stretch on that opposite hip. So just come in a little bit closer and you should be fine, all right? You could do this with weights. We can do it with weights. I like to hold the weight in both hands, okay? And you're just going to be doing the same exact movement. All right, let's move on to our next exercise. The last exercise that we'll be doing is the fire hydrant kick exercise. Now this one, we're not going to do it with any weights right now. If you can do it with good form, then you could loop a band around your knees. But trust me, it is a really tough exercise to do. So what you're going to do is, on a padded surface, just start on your hands and knees. And from there, you're just going to keep the core brace back straight, pelvis level, and you're going to raise the knee off of the floor. Now, a lot of people tend to rotate through the spine and raise that pelvis, but we want to isolate this to your hip, okay? So we really want to make sure you're keeping that pelvis level throughout the whole movement. So you're just gonna raise it up as far as you can without having to raise that pelvis. And from here, and this is the difficult part, you're going to extend the knee to kick that foot out. You're gonna really feel those glute muscles fire up, shorten it, and then come back, okay? So once again, you're going to raise the knee off the floor as far as you can, kick out the foot, bend it back in, and then tuck it back underneath your body. For this exercise, you can also aim for 8 to 12 repetitions. And if you want, you can always take a band, loop it around the knees, and do the same exact exercise. But trust me, without the band, it's gonna be more than difficult enough for you to get started on leveling up that hip. All right, so that wraps up our hip bursitis program. So we went over the acute, subacute, and late stages of healing. Now, during the late stages of healing, these exercises can be done between weeks 2 to weeks 12 post-injury, but it is going to honestly need some more advanced progressions and leveling up. So if you have any questions, let me know in the comments below. Be sure to subscribe and see you guys next time. Bye.